Welcome to another show of About Seniors Talk TV. I'm Victor Oliveira, President of In Our Care Home Care Service for Seniors and the host of this series. When we go see our doctor about an ailment, it's usually because we're experiencing symptoms or sensing something different with our bodies. However, not all health conditions present symptoms that we can readily detect. This segment is about such a condition. It's often called the silent thief, brittle bones, or in its true term, osteoporosis. Osteoporosis can occur both in men and women in a wide range of age groups, but commonly among older female adults. Somewhere in our early 20s, most people have acquired most of their skeletal mass. A decline in bone mass starts to occur in the mid-30s and continues more quickly in older adults, increasing the risk of osteoporosis. Osteoporosis is a disease characterized by low bone mass and deterioration of bone tissue, leading to bone fragility. It's called a silent disease because it's progress without symptoms or pain until a fracture occurs, usually in the hip, spine, wrist, or shoulder. It can lead to pain, disability, and in some cases even death. Our first guest is the President and CEO of Osteoporosis Canada and has been with the organization since 2006. Prior to joining Osteoporosis Canada, she was the former Provincial Osteoporosis Coordinator with the Ontario Ministry of Health and Long-Term Care. She's also held other roles in the Acute Services Division in the Ministry of Health and played a significant role in project planning, implementation, and evaluating of numerous provincial health initiatives, including chronic kidney disease, asthma, and age-related macular degeneration. Please welcome to our show, Dr. Jiwa. Dr. Jiwa, welcome to our show.
Thank you, Victor.
So, osteoporosis, what is it?
So, first and foremost, osteoporosis is not a natural part of aging. A lot of people think that as you age, your body deteriorates and osteoporosis just follows along in that vein. It actually does not. There are many things that contribute to osteoporosis. There is a component that could be genetic depending on your parental history of fracture, particularly a hip fracture. Poor or inadequate nutrition in terms of calcium and vitamin D, leading a sedentary lifestyle without weight-bearing exercise, excessive smoking, alcohol intake. There are certain secondary conditions of which those treatments can sometimes lead to what we call secondary osteoporosis.
So you say it's not something directly related with aging, but we hear it more prevalently among older individuals. And why is that? Is it just a detection process?
So typically individuals reach their peak bone mass around puberty, after which the natural process of hormonal change in the body will or can cause bone mass to decrease. However, there are things you can do to maintain or increase your bone mass. So these are eating a diet rich in calcium, making sure that you get adequate vitamin D through supplementation because vitamin D is not adequately available through diet, weight-bearing exercise such as walking, Tai Chi, as opposed to something like swimming, which is buoyant and doesn't really create that compressive force on bone, and basically maintaining your bone health. So while it tends to occur in older adults, it is really a concern for all age groups to not only build the appropriate bone mass, but to maintain it.
And you know, as I've read, it can affect either male or female, but we often hear it more among older seniors, female adults. Is that true? Is it more common?
So the data shows that 1 in 3 women and 1 in 5 men have a lifetime risk of breaking a bone due to osteoporosis. So the risk is higher in women, however, men are certainly affected.
And you also mentioned that it has some genetic component. So if my mom or dad are prone to it or are in the process of experiencing that kind of a problem, does that mean I will get it or my children will get it? How does it pass that way?
You know, the most important risk factor in terms of genetics is whether your parent has had a hip fracture. So osteoporosis in and of itself does not have any signs or symptoms. People oftentimes don't even realize they have osteoporosis until they fall from standing height and break a bone. So when I say from standing height, in the winter, oftentimes people will fall on ice from a standing position. They will tell us they fell hard or the ice was hard. That truly should not be breaking any bones. Your body should be able to withstand such a fall. So until you've had a broken bone, many people don't know that they have osteoporosis. So in terms of genetics, you want to see whether your mom or your dad has had a hip fracture. If they have, then that is definitely a risk factor for you.
So is there any tests that can be done to determine whether someone is losing bone mass?
Mm-hmm. There are actually two tests that are used to diagnose osteoporosis. One is a fracture risk assessment. So it's composed of various factors: genetics, lifestyle factors, family history, such as whether your parent has broken a bone, any type of medication you may be on, your lifestyle in terms of whether you smoke or drink, and it's inputted into an algorithm, which then spits out your risk of fracture. So we recommend at Osteoporosis Canada that individuals over the age of 50 get assessed for fracture risk. This can be done through your family doctor, or there are various tools on the Osteoporosis Canada website. So that's one tool. The other tool is bone mineral density assessment. And Osteoporosis Canada recommends that men or women over the age of 65 get assessed for bone mineral density testing. And what it is a very simple procedure. There's no pain, it's fairly quick, and it's meant to assess the integrity of your bone. So whether your bone has the adequate density such that if you were to fall from standing height, you would in fact not break a bone.
Okay. So what kind of factors, health factors, would be a concern, or that we either have osteoporosis ourselves or are concerned that a loved one may actually have osteoporosis?
So there are certain conditions, inflammatory conditions, which are treated by certain medications such as prednisone, certain cancer medications that can cause what we call secondary osteoporosis. Because while they are working very hard to combat the illness for which they have been prescribed, the side effect of those is sometimes to create fragile bone. The other things you want to look for are individuals who are below a certain limit on their weight, so extremely lean individuals, people who don't have a very active lifestyle, so people who are more sedentary, who are not engaged in weight-bearing activity, people who don't get adequate nutrition in terms of calcium and vitamin D. These are all risk factors that contribute to osteoporosis.
Okay. And some of the things that you're mentioning, will they actually prevent osteoporosis or simply mitigate the probability of getting it?
So the way it really is it reduces your risk of developing osteoporosis. So let's look at calcium. If you have a diet rich in calcium, Osteoporosis Canada recommends that you obtain 1,200 milligrams of calcium daily between diet and supplements combined. So if you calculate your calcium during the day, and there are many tools for this. We have a calcium calculator on our website where you can input your dietary intake, and if you fall short of that 1,200 milligrams at the end of the day, you supplement to make up to that level. In terms of vitamin D, it's not adequately found in food, so our recommendation is supplementation, 800 to 2,000 IUs a day. So these are very important things to maintain bone mass. Exercise, weight-bearing exercise, not only maintains but can increase bone mass because of the compressive force put on bone. So it's important that it's weight-bearing exercise.
And you're providing some great information, but not all older seniors have accessibility to the internet, to Google this type of information. Can they get this information from their family physician?
They can get it from their family physicians. Osteoporosis Canada also has a 1-800 toll-free number where Canadians can call and speak to our trained staff regarding their condition, perhaps seek some advice, be given some information in the mail if they're not able to access online.
And once you are diagnosed with osteoporosis, is there medication to help mitigate some of the issues associated with osteoporosis?
Yes, so if you fall into the high-risk category requiring medication, yes, there are actually many options available now in the marketplace. And for that, definitely, we would recommend that Canadians speak to their family physician to see what is best suited for them.
Well, thank you so much for coming on our show and sharing the information. I'm sure we only got a flavor of what you could truly offer our viewers, but we certainly encourage them to reach out to the Osteoporosis Society and get further information and help mitigate some of the issues that they might be encountering, or perhaps not even know they're already having the issue.
Thank you very much.
We'll be right back after a short break. Welcome back to About Seniors Talk TV. In this next segment, we're going to talk about a topic that is almost synonymous with aging: arthritis. Although the word arthritis means joint inflammation, the term is used to describe around 200 rheumatic diseases and conditions that affect the joints, the tissues, and surrounding the joint, and other connective tissue. The most common form of arthritis is osteoarthritis, and common rheumatic conditions including gout, fibromyalgia, and rheumatoid arthritis. Most types of arthritis are caused by a combination of many factors working together. Although some arthritis conditions have no obvious cause and appear to be unpredictable in their emergence, some people may be more susceptible to certain arthritic conditions due to their genetic makeup. Other factors may also include previous injuries, infections, smoking, and physically demanding occupations that can also interact with a person's genes to further increase the risk of arthritis. My next guest is an expert in the field and has been with the Arthritis Society Ontario Division for the past year, providing leadership, advocacy, and support. As their executive director, previous to his current role, he was the Director of Digital Health and Innovation for the past 10 years with the Heart and Stroke Foundation. He's earned his general medicine degree from the Lithuanian University of Health Sciences. Please welcome Dr. Ahmad Zbib.
Zbib, yeah, no problem.
Welcome to our show.
Thank you. My pleasure.
So most of us think of our arthritis pain as something that afflicts someone when they're older, but is that necessarily true?
That's a great question. We get it all the time. The fact that you know, the arthritis is more prevalent with seniors doesn't mean it's a normal part of the aging process. Actually, cancer is also more prevalent among seniors. It's just you know, there are multiple conditions at play that there's a ripe environment for them when people are getting older. But arthritis is not necessarily just a senior's condition. It happens in younger folks as well. There are even kids under 16 years old who suffer from arthritis. As far as the condition itself, as you mentioned astutely, and I was very impressed with the information that you shared, is that arthritis is a blanket term used for multiple conditions, actually over 100 conditions. And the way we'd like to think of it as two main categories. There's osteoarthritis, which most people think of when you think of aging seniors. And there's the inflammatory arthritis, which is also a group of conditions where inflammation plays an important role in the disease process. Osteoarthritis is basically when, you know, the cartilage between two bones wears off, and then you get bone-on-bone contact, and that causes pain and causes sometimes disability. In fact, arthritis is one of the leading causes of disability in Canada, with 20% of females and 13% of males have arthritis, and that number climbs up with seniors as well.
And I'm glad you clarified between osteoarthritis and osteoporosis, because a lot of people mix the two up, but they are distinctively different.
Absolutely, yeah. And going back to the Latin or the Greek origin of the word, osteo, it means bones. And porosis, it means, you know, it becomes porous. It has holes in them. So osteoporosis is when your bone density gets reduced over time. Osteoarthritis, it's when the bone around the joint is affected and is diseased.
Okay. So how does one know if you are suffering from arthritis? I mean, As we age, you know, our bones become a little achy and sore.
Right.
But that doesn't mean it's arthritis. So how do we know, and how are we able to distinguish which is which?
Right. So we all get this twinge in our shoulder or in our knee, and nothing that you can fix with some ice, some pain medication like ibuprofen, or even some stretching. But if the pain persists over time or keeps coming back, then you should actually act fast, because the first step is seeing your healthcare provider, primary healthcare provider, whether it's a primary care physician or a nurse practitioner, to rule out some of the more aggressive forms of arthritis, which needs to be arrested quickly before damage is extensive. So what we say is, as soon as you feel the pain, and if it's persistent, just book an appointment, see your doctor, and until you see the doctor, you can actually go to our website, arthritis.ca/education. We have a tool called Symptom Checker that can help you through a bunch of questions. We will give you some likely scenarios that you can discuss with your healthcare provider.
So that's to see if you fit into the category,
Right.
whether you can determine yourself. But is there any medical tests that can be done to really authenticate the condition?
Absolutely, and this is where the doctor or the nurse practitioner comes in, and they can order a bunch of imaging tests, such as an X-ray, a CT scan, or MRI. And also, in case of inflammatory, there are some blood tests that they can do to confirm whether you have that condition or not.
Okay. And once we are diagnosed with it, what can we do to mitigate some of the symptoms? It's not reversible, I would assume. So what would one do to mitigate some of the experiencing that comes with having arthritis?
So it starts right away from the moment you're going to receive a diagnosis. We say ask a lot of questions. And oftentimes, it's actually overwhelming for patients when they receive this diagnosis. You have arthritis. It's a lifelong condition. So they don't tend to remember all the information that's told by the doctor. So what we recommend is bring a trusted friend or family member who will take notes. And before you leave the doctor's office, make sure you have the following covered. One is what type of arthritis you have, what joint is affected, and what's the severity of the pain, and what are the next steps available to you. If it's inflammatory, then you should ask for a referral to a rheumatologist, and as soon as possible, because you want to arrest the aggressive forms of inflammatory arthritis. You can also go to our website and learn about how you can manage some of the symptoms. The number one reported symptom of arthritis is pain. So we have on our website a module that helps people manage their chronic pain. We also have in-person workshops that people can attend. We also have modules on fatigue, because fatigue is very common with people with arthritis. So it's important that you learn and become your own advocate of your own health. And oftentimes you'll find that people, over a course of years, they become actually a bit more knowledgeable than their primary care physician on how to manage their symptoms if they're attuned to it.
And once you have a diagnosis, is the condition progressive? Does it get worse with time?
Often it is. There's been a lot of progress on the inflammatory front. Within the last 20 years, there's been introduction of a new class of medication that has improved significantly the prognosis of the disease. On the osteoarthritis front, we're still not there. There's a lot of work to be done, and that's why we're funding some really interesting research in terms of regenerative medicine, personalized medicine, to create, to be able to create some sort of organic tissues in the lab that can potentially replace a cartilage, for example, or to teach the body on how to repair itself. We predict within the next 5 to 10 years there's going to be some major breakthroughs in research that will help people living with osteoarthritis.
Now, you also mentioned that people with arthritis tend to become more fatigued. Is that just through pain managing their pain that causes the fatigue, or is there other underlying things happening?
Right. So there are multiple factors that can affect that state, and one of them is when you're in pain, especially at night, you don't tend to sleep well, and that can contribute to your fatigue. The other causes are, state of heightened inflammation in the body can also lead to, and it's not entirely known how, but it can lead to this chronic fatigue as well.
Okay. So the Arthritis Society, if people are calling Arthritis Society, you're providing support, advice. What other things can people expect when they're calling the Arthritis Society to help them cope with their diagnosed condition?
So there are multiple ways that we can help. In Ontario, for example, we have a program that is covered by OHIP, where we would, with one of our specialized physiotherapists, like occupational therapist or even social worker, can help devise strategies for these patients on how to manage their condition, on how to become better self-managers of their disease. We also have, great information, as we mentioned, online. And we under what we call our care bucket, we have programs where we're training healthcare providers across the country in becoming experts in arthritis care. So there's a program that trains pharmacists, and you tend to see your pharmacist more often than you see your doctor. So if there are pharmacists trained in arthritis, we're creating places in the community where you can go and talk about that.
And I know we could go on for hours about this, but we have about a minute left. How do people contact you if they need to speak to you or to the Arthritis Society? You want to share that with us?
Absolutely. So you can go to our website at arthritis.ca, and or you can call our number 1-800-321-1433. We actually look forward to connecting with people with arthritis.
Well, thank you so much for coming on the show, sharing your information. And I know we just covered just the tip of the iceberg when it comes to this condition. But I think what we're trying to do is bring some awareness and get people interested in the topic and perhaps reach out to you and learn more about what could happen to themselves or to a loved one. Thank you.
Thank you.
We'll be back after a short break. Thank you for watching another episode of About Seniors Talk TV. I would like to thank the guests who appeared on today's show to share their experience and knowledge with us. Dr. Jiwa, President and CEO of Osteoporosis Canada, and Dr. Ahmad Zbib, Executive Director of the Ontario Division of the Arthritis Society. We certainly hope you're enjoying the series and benefiting from the brand of information being shared with you. If you have any questions or concerns or have a general inquiry, you can contact me directly at Oliveira@inrcareservices.com. Thank you.